Hello, Sister Moyo. I've just been going through the revised SOPs for HIV testing services for children and adolescents, and I'm struggling to understand a few things. Can you talk with me about them?
Of course, Councillor Shoko. Please, come in.
Well, I'm particularly concerned about the age of consent. It's now set at 18 years, and I'm wondering about how to approach testing for children and adolescents who might not meet the age of consent or come without a parent or caregiver but still need our services.
That's a valid concern. First, when offering HTS to children and adolescents, it's essential to ensure we adhere to the ethical principles. Rights of the child, age of informed consent, best interest of the child, informed consent, and confidentiality. Now let's discuss how we can provide quality HIV testing services to these children and adolescents. The age of consent is indeed 18 years and above, but there are exceptions for emancipated and mature minors.
Emancipated minors? Can you tell me more about that?
Certainly. Emancipated minors are individuals under 18 who seek HIV testing services and are either pregnant, parents, or married. They are permitted to provide consent for HIV testing and post-test linkages on their own. Let's talk about two scenarios where the child or adolescent is not an emancipated minor but requires HIV testing services. Our commitment here is to adhere to the ethical principles and provide a non-judgmental, youth-friendly service.
Welcome. It's great to see both of you here today. I am Shoko. Everything we discuss here is confidential. May I know your name?
I'm Joseph. I'm 16 and this is my dad.
How can I help you, Joseph?
I'm here for an HIV test and I'm a bit nervous.
Understood. And how are you feeling?
I'm just worried about the whole process and what it involves.
It's natural to feel that way. I'm here to make this process as comfortable as possible for both of you. I'll provide detailed pre-test information, explain the testing process, possible results, and post-test linkages. I'll talk with you together, and we will then talk with each of you individually for a few minutes before we begin. Does that sound okay?
If the parent denies consent, talk with them about the benefits of HIV testing for the child and address their concerns. You can also offer HTS to the parent or caregiver themselves. When necessary, you may involve the clinic manager to provide further counseling for either the child or the parent or caregiver.
Really? That would be very helpful.
There are instances when a child or adolescent seeks HIV services alone. This demands extra sensitivity to determine if they are mature enough to provide their own consent.
Hi. Hello. I am Councillor Shoko. Our discussion is confidential. May I know your name? I'm Faith and I am 15 years old. What brings you here? I have a boyfriend and we've been having sex, and I want to make sure that I didn't get infected. It is good that you're taking charge of your health. We'll discuss basic facts about HIV, testing process, linkages, and consent. Is that okay? Yeah, that sounds okay.
Children and adolescents who present alone and are at risk of HIV infection are categorized under mature minors. The facility or outreach manager will assess and decide on behalf of the child or adolescent. Refer to the SOPs.
Can you tell me more about post-test services?
Post-test linkages are based on test results. No matter their results, all clients need risk assessment and access to essential services like sexual reproductive health and support for disclosure. For children and adolescents testing HIV negative, emphasize on maintaining negative status. HIV prevention services available include abstinence, condoms, PrEP, which can be oral, vaginal, or injectable, PEP, and VMMC. For those testing positive, emphasis is on support. Provide art services, mental health assessment, positive living, and psychosocial support. Finally, offer follow-up methods like telephone follow-ups, home visits, or engagement with peer or community cadres.
Great! All clear now. Thank you.
Remember, our goal is to provide comprehensive, high-quality, family-focused, and youth-friendly services. Keep up the good work, Shoko.